Hello friends, welcome to our YouTube channel Odontology, Study of Teeth. Today we are going to see other histological aspects of a tooth. For that I have drawn a longitudinal view or the longitudinal section of a anterior tooth. Also it is also can be called as anterior tooth in situ. So we'll see the hard tissue structures of the tooth. In that first structure is enamel. So it is white in color. Okay, covers the crown of the tooth. So next will be, so other things what I have drawn inside the enamel are the histological aspects of the enamel that will be covered in consecutive videos. So next hard tissue structure is dentin. So dentin is yellowish in, light yellowish in color, however it darkens with age. It cover dentin you can divide into two morphological types, that is coronal dentin and radicular dentin. So this will be your radicular dentin. Here it is your coronal dentin. Next will be your pulp or the pulp changer, where your pulp tissue will be present. Okay, pulp is the soft tissue of the natural tooth. So first, what is the first? These two are hard tissues, that is enamel and dentin, and it is subsequently it is embedded with pulp chamber. Pulp, with the pulp tissue is seen within the pulp chamber, that is your soft tissue component of the anterior tooth. Both anterior and posterior also it is seen. Okay. So next we will see about the supporting structures of the tooth. So in that includes, first is cementum. This yellowish part is called as cementum. That is also a hard tissue surface. So the supporting structures of the tooth are, first one is cementum, then next is periodontal ligament with, you can call it as periodontal ligament space, where your periodontal ligament fibers are seen. So these are your periodontal ligament fibers. Next is, so the tooth is in situ with alveolar bone. This is your alveolar bone. So the last portion is, this is your apical foramen on the apex of the tooth, where your nerve and blood supply will be running into the pulp chamber with the pulp tissue. And the final one is gingiva. This is called gingiva, that covers the neck portion of the tooth. When you see your tooth in the mirror, you can see the tooth enamel as well as at the neck portion of the tooth you can see the pink color or the pink hue of the gingiva. Okay. So next is, I have drawn the posterior tooth in situ. So all the structures are almost same. Okay, there is no difference between each tooth. Okay, first is enamel, then dentin, you have pulp. So here these two are pulp horns. Okay, these two are pulp horns. This one and this one are pulp horns. Okay, in posterior you can see properly. Okay, pulp horns. So this is your pulp within the pulp chamber, inside the pulp chamber, and these are your blood vessels and nerve. Okay, so this is your gingiva. So in the anterior tooth you have single root, and in posterior teeth you have two roots. Okay, molars will have two roots. So we'll just recall before concluding the video. First we saw just is this longitudinal view or the histological aspects of the natural teeth we are seeing. For that I have drawn the longitudinal view. In that, the hard tissue structures are enamel, next will be your dentin, Third is pulp, that is it's in the pulp chamber, that is a soft tissue. Okay. In dentin, you can divide the dentin into two types, anatomical types, that is coronal part and radicular part. Yes. So that is up. Then next we saw about the supporting structures, that is first is cementum, then periodontal ligament space with periodontal ligament fibers, then gingiva, okay, that covers the neck of the tooth, gingiva, and finally it is embedded within the alveolar bone. So this last anatomical portion is apical foramen or the apex. Same thing it is also seen in the posterior also. First we saw about the enamel, dentin. Here we can see two pulp horns, okay. Pulp horns are more evident in your posterior tooth. Then pulp within the pulp chamber, gingiva, then blood vessels and nerves. So if you like this video, press the like button and subscribe to my channel for new upcoming videos. Thank you.